Remember when I told you no matter where I go, I'll never leave your side, you will.
Assalamualaikum warahmatullahi wabarakatuh. Hello guys, my name is Nurjannah Maulida. I am from the Faculty of Health Science Nursing Study Program. In here, I will explain about definition, symptom, treatment, and prevention from anemia. Lack of blood. Anemia is a condition when the body lacks red blood cells or when the red blood cells don't function properly. As a result, the body organs are not. Adults are said to suffer from anemia when their hemoglobin level are below 14 grams per deciliter for men and below 12 grams per deciliter for women. When the hemoglobin level is below X gram per deciliter, anemia is already severe and is referred to as anemia gravis. Broadly speaking, anemia occurs due to the following three conditions: less red blood cell production, excessive blood loss, the breakdown of red blood cells too quickly. The following are common types of anemia based on the cause. 1. Anemia due to iron deficiency. Lack of iron makes the body unable to produce hemoglobin. This condition can occur due to insufficient intake of iron in food or because the body is unable to absorb iron. For example, due to celiac disease. 2. Anemia due to bleeding. Anemia can be caused by heavy bleeding that occurs slowly over a long period of time or occurs suddenly. The cause can be injury, menstrual disorders, hemorrhoids, inflammation of the stomach, colon cancer, or side effect of drugs, such as non-steroid anti-inflammatory drugs. In addition, anemia due to bleeding can also be a symptom of intestinal worms due to infection with worms that sucks blood from the intestinal wall. 3. Anemia due to chronic disease. Several diseases can affect the process of red blood cell formation, especially if they last for a long time. Some of these include corn disease, kidney disease, cancer, rheumatic arthritis, and HIV or AIDS. 4. Thalassemia. Thalassemia is caused by a gene mutation that affects hemoglobin production. A person can suffer from thalassemia if one or both parents have the same condition. Symptom of anemia. Symptoms of anemia vary widely depending on the cause. Anemia sufferers can experience symptoms such as limp and thirst quickly, headaches, and dizziness. Frequent drowsiness, for example, drowsiness after eating. The skin look pale or yellows. Irregular heartbeat, shortness or breath, chest pain, cold on the hand and feet. When to see a doctor. If you feel tired or experience symptoms of anemia that get worse over time, see your doctor. If you suffer from anemia that requires long-term treatment or even regularly receive blood transfusion, then you need to carry out routine control to the doctor to monitor the progress of the disease. Consult your doctor if you have conditions that can cause anemia, such as kidney disease, menstrual disorders, colon cancer, or hemorrhoid. Diagnosis of anemia. To determine if a patient has anemia, the doctor will perform a complete blood count. By examining a patient's blood sample, the doctor can determine the hemoglobin level in the blood. Normal hemoglobin level depends on age, condition, and gender. A person can be said to have anemia if the hemoglobin level is below the following number. Children 11 until 16 gram per deciliter, pregnant woman 11 gram per deciliter, men 14 until 18 gram per deciliter, woman 12 until 16 gram per deciliter. Through a blood test, the doctor will also measure the level of iron, hematocrit, vitamin B12, and folic acid in the blood, and check kidney function. This examination is carried out to determine the cause of anemia. Anemia treatment. Some examples of anemia treatment or blood deficiency drug benefit are anemia due to iron deficiency. This condition is overcome by consuming food and iron supplement in safeguards blood in transfusion are required. Anemia due to bleeding. This condition is treated by stopping bleeding. If needed, the doctor will also provide iron supplement or blood transfusion. Anemia due to chronic disease. This condition is treated by treating the underlying disease. In certain conditions, blood transfusion and injection of the hormone erythropoietin are needed to increase the production of red or blood cells. Thalassemia. In treating thalassemia, doctor can perform blood transfusion, folic acid supplement, spleen removal, and bone marrow graft. Anemia prevention. Some types of anemia, so as anemia during pregnancy and anemia due to iron deficiency, can be prevented by eating a diet rich in nutrition, especially food rich in iron and folic acid, so as meat, cereal, nut, dark green leaf vegetable, bread, and fruit. Food rich in vitamin B12, so as milk and its derivatives, and soy-based food, so as tempeh and tofu. Fruit rich in vitamin C, so as orange, melon, tomato, and strawberry. To find out whether your nutrition intake is sufficient, consult a nutrition especially if you have a family with anemia due to genetic disorders such as sickle cell anemia or thalassemia. Consult your doctor before planning a pregnancy, so that this condition does not occur in children. Thank you very much for you watching this video. Wassalamualaikum warahmatullahi wabarakatuh.
Remember that I told